My topic is going to be on drug-assisted therapy, and it will review the health and financial consequences of the therapies. There are three subtopics within my presentation, which are psilocybin in therapy, ketamine, and MDMA used in therapy. This is a topic that kept coming up in our group, and I thought it was really interesting and especially relevant for all the current research going on today. In the topic of psilocybin used in therapy, the first study was a systemic review which assessed 4 studies in the efficacy of psilocybin in patients with substance use or non-substance use disorders. 3 studies focused on alcohol use disorder and 1 was on tobacco use. So the studies measuring alcohol use, the first study found that heavy drinking days were decreased by 95%. The second found that participants became completely abstinent from alcohol. And the third was a double-blind randomized clinical trial with 93 patients. The variable was psilocybin and the control was diphenhydramine, which is an antihistamine. At 32 weeks of follow-up, the patients that were given psilocybin as opposed to the placebo had a significantly lower percentage of heavy drinking by 41%. And adverse events were mild. There was some mild increase in blood pressure, but by the group they utilized psilocybin, but that declined 6 hours later. No patients were treated for hypertension. Continuing on the topic of psilocybin and continuing that study number 1 of the systemic review, the study measuring tobacco use disorder found that the prevalence of smoking abstinence at 26 weeks was reduced by 80% and by 52 weeks by 76%. The second study reviewed the effects of psilocybin in therapy in multiple contexts, which included the alcohol and tobacco use disorder, but this one also included mood and anxiety disorders. In that study, the study found that under the context of life-threatening cancer diagnoses, depressive symptoms were markedly reduced at the final follow-up 3 months later. Under the topic of ketamine in therapy, this study was a systemic review that was reviewing 7 studies that use ketamine in treatments of substance use disorders. 2 of the studies were on alcohol use disorder and 3 were on opioid use disorder. Those studies found improvements in abstinence rates in the ketamine group with significant between-group effects for up to 2 years following the single infusion. On the next 2 studies were on cocaine use disorders, where they found improvement in cravings, motivation, and decreased use. So moving on to the topic of MDMA in therapy, the first study analyzed the health and financial consequences of MDMA-assisted therapy in patients with PTSD. Expanding access to just 25 to 75% of eligible patients was projected to avert at least 43,618 and up to 106,932 deaths, and would gain 3.3 to 8.2 million quality adjusted life years, which is a unit that is used in the prediction of both quality and duration of life after medical or surgical treatments. Additionally, they found that one analyzation that provided MDMA-assisted therapy to 1,000 PTSD patients would save the healthcare system approximately $132.9 million, while averting 61.4 premature deaths and generating 4,856 quality-adjusted life years over the span of 30 years. So continuing on with MDMA utilized in therapy, the second study was a double-blind randomized placebo-controlled trial measuring the effects of MDMA-assisted therapy in patients diagnosed with severe PTSD. Common comorbidities were dissociation, depression, history of alcohol and substance use disorders, and childhood trauma. The MDMA group induced significant reduction in both CAPS-5 scores, which is a score that calculates PTSD severity, as well as the Sheehan Disability Scale, which is a measure of disability and impairment. So both of those were improved significantly, especially when compared to the placebo group. In conclusion, drug-assisted therapy has shown promise for substance use and alcohol use disorders and has shown potential benefits ranging from individual, societal, to overall financial burden of healthcare costs. Only one of those studies had mild adverse effects, and that resolved within the duration of the treatment session. All the other ones showed low to no adverse effects. That concludes my talk. Thank you.